she was really still just not satisfied with the result. So I told her we always have a second choice that we can do. So she came in a month or so later, and we ended up doing the hyaluronic filler under the eyes. She got immediate results.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Misty Burton of Blush Medical Aesthetics and Wellness, who has over 28 years of nursing experience and 7 years as a family nurse practitioner. She brings a deep foundation of clinical knowledge, compassion, and a passion for helping others. Her journey into medical aesthetics began in 2024, and since then she has undergone extensive hands-on training at a reputable local med spa, mastering the art and science of facial aesthetics. Misty has completed advanced training courses with Dr. Tim Pierce, a world-renowned aesthetics educator and clinician based in the United Kingdom. So Misty, welcome and glad to have you here.
Thank you, Daniel. So glad to be here.
Yes, let's dive into it. How did you first get interested in medicine?
I guess because my mother was a nurse. I had always seen that in my lifetime, and she was such a wonderful nurse. And I just followed in her footsteps way back when I was in high school.
Okay. And so you have this long experience as in nursing, and then even as a family nurse practitioner. So what was it that caused you to want to make that transition over to aesthetics?
I had a wonderful job that I loved, and unfortunately, that clinic closed at the time. And so I was wondering, what do I do with my life? Where do I go from here? And so there was an aesthetics course in Memphis, Tennessee, not far from me. And I just decided to take the course. Had a wonderful instructor, and I just went to the course and I just fell in love with aesthetics. And ever since then, I've just loved it, and I've just dove into different training courses. And then I actually contacted the instructor that taught the class. She owns her own med spa. And I ended up doing about 3 months training in her med spa with her and fell in love with it even more after that.
So it almost sounds like it was fated to happen, just happened to have an interest in it, and then you just fell in love from there.
That's right. That's
Okay.
right.
So now that you have your own practice, what are some of the most common treatments that your clients and your patients come to you for?
We do a lot of the tox. I don't have the Botox. I have the Letybo. The Letybo is a newer tox. It's just been FDA approved for use here in the United States, and it came from Korea. And you know, the Koreans have wonderful, wonderful skincare products there.
Yeah.
And I have been very happy with the Letybo. It is a wrinkle relaxer. So I have a lot of patients that use that. They're very pleased with the results. I do the fillers, the lip fillers. I do a lot of dermal fillers, under eye fillers, just facial balancing in all parts of the face with the fillers. So that's really popular at my practice. I do microneedling, and I do chemical peels, and I have some facials that I do too. Those are really popular. I do even some minor illness visits. If someone comes in and they need something for, just say, a urinary tract infection or a sinus infection, something, you know, basic, I'll come in, do an exam and treat those. I have Definage skincare products that are really good for aging. I have lots of creams and neck creams and just a whole line of skincare products that are really, really good that my patients have really had a good success with that as well. I can even do blood work or urinalysis here at the clinic if that's needed. And I do a lot of wellness injections as well. I do the NAD, which is the popular anti-aging injection. I do a glutathione injection. That's really popular for the people that have hyperpigmentation or have a lot of acne. That treats those areas as well. I have some vitamin B12 and lots of other wellness injections that people just really love here. I actually do some hair restoration. So what we do is we draw the blood from the patient and we spin it down. And when we spin it down, we get the PRF, protein-rich fibrin, from the blood. It separates it from the red blood cells and separates the plasma, which is the golden liquid. I take that golden liquid, has a lot of stimulating growth factors in it, and I put it through a heating process and a cooling process. And then when I combine those together, it forms a gel out of the patient's own blood that can be injected to fill the under eyes, fill the lips, just facial balancing in itself with their own blood products.
Wow. Okay. So you do quite a bit then. I do want to dive deeper into the NAD because that's something that I'm seeing more and more aesthetic practices bring on as far as more the wellness side. So I guess before, like when it comes to medical spas, it was really just injectables, maybe lasers strictly on the aesthetic side. But I'm seeing more and more starting to get into the wellness side, the regenerative medicine side that you were talking about. So for NAD, let's dive deeper into that one. What is it? What is NAD and how does it help?
NAD is an anti-aging peptide, so it renews the cells down at the cellular level. It repairs the cells. It helps with detoxification of the cells. It gives you a really good burst of energy as well. There is a little side effect of flushing when you get the injection. So I always let my people sit down, relax for a few minutes after they take it just to make sure that they're not going to have too much flushing. I always take their vital signs before we give the shot, and lots of times afterwards too, because it kind of is an immediate rush of energy. Now, NAD is really popular for the gym population as well. So there are a lot of people that go to the gyms, and I've had patients to tell me, "Oh, Misty, since I've started the NAD, my endurance is better. I'm lifting, heavier weights, and just overall feeling so much better."
Okay. So it's an injection. So, and you said that generally can be applied to really anybody. Like it's almost like I guess like a vitamin that you can kind of take and then just gives you that overall bump in health. Do I understand
Right.
correctly? Okay.
Yes.
So with the NAD then, is it anyone can take it or just certain people? And then how often should they be taking it?
Well, we would not give it to anybody that was pregnant or breastfeeding, things like that, or if they were allergic to any of the compounds or any of the ingredients in that. Of course, we wouldn't give it to those patients.
Mhm.
But anybody else, has been, tolerating it well. You can get it up to a couple times a week. I usually like to start my people out at the lowest dose just to see how they're going to tolerate it,
Mhm.
which is a 25 milligram. And then they'll come weekly, and then I'll bump it up to a 50 milligram, see how they're tolerating that. And you can go all the way up to 125 milligram.
Okay. And is it always in injection format or can it be taken as like a liquid or a pill or is it like what's the different ways that they can get it?
I have seen it like on TikTok, where you can buy it as a supplement. I've actually gotten a supplement by mouth of the capsules. I believe they were capsules. And I really didn't feel any difference.
Mm.
Now, when I do the NAD, I can really feel a difference with the injection. Now, NAD can be given IV. I'm wanting to get into the IV hydration spectrum here soon as well. So the NAD can be given IV. A lot of celebrities get the NAD
Mm.
through the IV.
Okay, got it. And I also want to tie into the glutathione as well. Can you talk about what that is and how does that help?
So glutathione is a liver detoxification injection, and it helps with skin brightening, skin lightening, helps with acne, things like that as well. That's a 600 milligram dose weekly, and you have to take that for about 4 to 6 weeks to really start telling the difference. But I have people that are coming consistently weekly. They love it. Their skin has cleared. Their skin is brighter. Their skin is healthier. So they're really, really loving the results.
Okay. So if it's liver detoxification, sounds like it's something that if people drink a lot, it'd be good for that, but maybe that's not the right application of it.
Yeah, it might. I would have to look at the research studies to tell you
Yeah.
for sure. But
Okay.
it does liver detoxification.
Okay. So in this case, then, is this something kind of like the NAD that really anybody can get just for overall skin health and clearing things up? Or is it really just like, hey, if you have these skin issues, you should take this, or if you have this issue, you should take it, but otherwise it's not going to be helpful for you if you don't have these issues?
It's more for the people that really have those issues. I would hate to just give a medication to somebody that really didn't need to improve their skin.
Mhm.
So we really give it to those that have problem areas in the skin.
Okay. And glutathione, is that also injection or is it pill or is it how is it being?
That is given intramuscular as an
Okay.
injection.
Okay, got it. So when people get it, then within 4 to 6 weeks, they'll probably start seeing some results. And it's really if
Yes.
they're having, what was it again, like some issues with the skin?
Like hyperpigmentation, which is dark spots, acne, things like that.
Okay, so even if they have acne, then it's some, and if it's whether they're younger, like teenagers going through puberty having acne, or whether they're adults having acne, is it going to be good in both situations, or really just for one type of age group or situation?
I really don't have the teenage population here at my clinic, so I've not had any teenagers to come to ask for it. So I'm treating usually the 30, 40, 50 range group in my clinic with the glutathione.
Okay. Okay. And then you also touched on the regenerative medicine using the, I think it was PRP or was it PRF that you were using? Or both?
It's PRF.
PRF. Okay. So with regenerative medicine, for people who are not aware of regenerative medicine, could you explain a little bit what is regenerative medicine and what's the biggest benefits of it that you've seen?
So regenerative medicine, as far as the easy gel and PRF hair restoration that I do here, of course, is drawing your own blood, taking your own blood products and injecting them back into yourself. So there are some people that may not want to get synthetic fillers for their lips or synthetic fillers that come already prepackaged for their under eye tear troughs or other areas. Or they may be allergic to that and they want to use their own blood products. So that would decrease some of the allergic reactions. Your body is not going to reject your own bodily fluids. So we have no problems with that. The only thing with the PRF is you may have to have a few treatments about a month to 6 weeks apart to have the maximum results.
Mm,
But after you get that first injection, it's going to continue to work for several weeks to restore the volume, the collagen, the elastin that's missing in the certain area that we have injected.
okay. And about how many treatments would you say that the average person would need to really start seeing results, and how long do they typically last for?
Yes, they usually do about 3 treatments, about 4 to 6 weeks apart. And once they get their benefits and they're like, okay, my eyes are better, my lips look better, everything looks better, then we would maintain with maybe 1 or 2 treatments a year.
Okay. Now, I'm sure that you get a lot of people coming in, they have a lot of misconceptions or there's a lot of myths out there about these types of treatments specifically. What would you say are some of the most common myths or misconceptions that you hear?
The misconception that I hear with the Easy Gel PRF is that you're going to get immediate results.
Hmm.
So if you do the synthetic or the hyaluronic acid fillers under the eyes or in the lips, you're going to get an immediate result with that. And you may get a little bit of an immediate result with the PRF, but it's not going to be as immediate as the hyaluronic acid. Like I said, it's going to take several treatments
Yeah.
to get the maximum benefits.
Okay. And how about on the NAD and glutathione part? Like, what's some of the myths or misconceptions you hear on those treatments?
The NAD, a lot of people want to come in and take one injection and they want to just feel fabulous, and just have a boost of energy,
Mhm.
which you can feel a boost of energy with that, but it's not going to be the maximum results unless you're coming continuously to get those and get a buildup of it in your system.
Okay, so it's not a silver bullet.
Right, right.
It's part of a silver bullet.
Right, right. So that's like aesthetics in general. One aesthetic procedure is not going to benefit the whole face. So
Mhm.
say somebody wants to get their lips filled, their under eyes filled. Well, if their skin is breaking out or oily, well, we need to correct that as well. So we may need to do a chemical peel. We may need to do microneedling. So a lot of people come in and they think their whole face is just going to glow with one small treatment, and that's all they're going to have to get. And they look at me and they're like, well, you look, good. What do you have done? And I say, well, it starts at home with my medical grade skincare. You have to have your skincare regimen at home. I do it twice a day. I do microneedling, chemical peels. I do the tox. I do the fillers. I do everything that we do here. So one treatment is not necessarily to be the silver bullet for everyone. It's usually going to take a combination of treatments.
And in that vein of combination, what should people be aware of? Like when they're coming in, they want to look better as far as, oh, I just want to do one, I just want to do Botox, I just want to do filler, I just want to do this or this or this, versus having that combination. Hey, if whatever your end result is, you should do this and this and this. Like what is going to be that defining factor that people should consider? Should they do combination treatments or should it just be one type of treatment?
Well, we really discuss that during our consultation. So I usually bring the patients in, we have a consultation, and I let them tell me what their concerns are and what they're wanting to correct. So I always tell them, I'm going to give you everything that I offer that would correct this certain issue that you have. So I go through if they're a candidate for the microneedling, the chemical peel, the tox, the fillers, and I just tell them everything that we can do to fix whatever their concerns are. And I always tell them it's not an overnight process. We can't do all of this in one day and have the results tomorrow. So it's a baby step process. I always tell them it takes time. And ultimately, it starts with medical grade skincare at home that you have to be consistent with daily.
Okay. And so let's say that somebody is, your average consumer is looking for a provider to help with this, to help guide them on this path. What would you say is the most important piece of advice you can give to someone to make sure they find that right provider, the one that is really going to click with them, the one that really is going to be able to help them and has the knowledge and experience to do so?
Right. Well, it starts with that consultation. So you need to have an in-depth consultation. You need to really sit down and listen to what the patient concerns are. You need to make your recommendations, but some people may not want to do those recommendations. So you try to work with the patient. It's a two-way street. So the patient gives you their concerns, you give them the treatment options, and then you both devise a plan of treatment together. So I think that's really important. I think it's really important that the patient realizes that they're being listened to and being understood and developing a plan together, as two people combining to make the plan together, I think is really good.
Okay. And what would you say are some red flags that if people are seeing this, then they're like, hey, maybe I shouldn't consider this person, or I should at least look at somebody else? What are some of those red flags that you would recommend that they keep an eye out for?
So I would probably think red flags would be somebody that pushes a treatment on a patient. I would never push a treatment on anybody. We always talk about it. If that's something that they absolutely do not want to do, then I'm not going to push it on them. This needs to be a mutual agreement because the patient is not going to be happy if they are undergoing a treatment that they didn't want or they didn't ask for. So I'm going to always respect my patients and let them help decide and steer the treatment plan. Now, if it's something that's totally unsafe for the patient that they're wanting to do, they may be upset about that, but I'm not going to do anything that's unsafe or that's going to cause, an upset of their skin ecology or that's going to be worse for them. It's not going to be a clear treatment plan. It's not
Mm.
going to benefit the patient.
Hmm. And what about quality of product? So I know with like Botox injectables, the fillers, the quality of, you want to get the ones that are from the manufacturers, you want to get the off-label or the ones from Temu or Amazon. But what about specifically for NAD or glutathione? I'm curious, are there different levels of quality with that? And is that something that the consumer should be aware of, like what kind of quality of these products that this practice is using?
Yes, the NAD and the glutathione are peptides, so they have to be purchased from a reputable pharmacy here in the United States. I have gotten all my pharmacy certificate of analysis and their API, which is testing to make sure that all their products have passed the rigorous testing and are satisfactory to be injected here in the United States. And
Hmm.
I have all that as documentation. If any of my patients would like to see that at any time, I do have that on record here in my clinic.
Okay. Is that something that you recommend that people ask for or be aware of, or is it something that's usually not much of an issue most of the time?
You know, the patients may not even know what API and COA are.
Mhm.
I definitely think it wouldn't hurt to ask your practitioner where are you getting your medications from, just to make sure that they are a reputable pharmacy. So I definitely think that that's a good idea. And I think that's great.
Okay. And I'm curious, what role do you believe creativity plays in how you approach your patient care, your client care? Because when it comes to medicine, it's obviously we have the protocols in place. You have to follow this so that you are being aware of their health and that you're not going to do any harm to them. But also, everyone is individual and everyone has a personalized situation. So, how much, or I guess, how important do you think creativity is in what you do?
I think creativity is very important in what I do, and that happens from the time they come in for their consultation. I always get from a lot of people, I don't want to come out of here looking fake. I don't want the duck lips. I don't want this. I don't want that. And I always reassure my patients that they are my artistry, they are my canvas. So that doesn't mean that I might not make a mistake. You know, we're going to try not to make a mistake, but they are my artistry. So I am going to take every injection that I give them, every facial balancing that I give them is going to be taken very serious and meticulously. And I think that that just speaks volumes of the injector, because if I had someone come out of here that looked really bad, that's going to speak on my artistry. So I always tell them, you are my canvas. When you go outside my doors, I don't want you to look like you've had any kind of procedure done. I want you to look like you've been well rested, you've had a good night's sleep, and you're looking refreshed. That's my goal for each patient.
Okay. So they're like your billboards. Every time they leave your practice, they're the billboards showing your work off to everyone else.
Absolutely. Absolutely.
Okay. Now, Misty, I'm sure that you've run into some tough cases or challenging cases over your experience. Is there maybe one story that stands out in your mind that you're okay sharing of just a tough case or a memorable case and how you were able to get them a successful result in that?
I had a lady that had very, very dark under eyes and very, very hollow. And we did several of the easy gel PRF um, procedures, and she was really still just not satisfied with the result. So I told her we always have a second choice that we can do. So she came in a month or so later, and we ended up doing the hyaluronic filler under the eyes. She got immediate results. The hollowness, the hyperpigmentation that was there was gone. It's not gone all the way. She's going to come in the next few weeks, and we're going to see if we might need to touch up, or we're going to have another look at it. But just because we do one treatment and it doesn't work, or it doesn't work as effectively as the patient thought, doesn't mean that we don't have another option. So I like to have several options to treat several areas. So she's been happy with the results so far.
Okay, great. And I'm curious, where do you think the future of aesthetics is going?
Oh, there's no stopping aesthetics. There's no cap or no cutoff.
Mhm.
It's just going, and every day I have reps texting me or calling me. We have new products, we have new medication, we have this new training, we have that new training, and it is going so fast that I actually cannot keep up with all the new products that are coming out. I really try to, but there's so much changing. Just every few days, I'm getting messages about new treatment plans that
Mhm.
are coming out in aesthetics.
Mhm. Well, you have wellness products and services, and you also have regenerative medicine treatments in your practice. What do you think it is that's fueling that? Because I mean, back in the day, when it comes to med spas, it was strictly just the aesthetics, the fillers, the injections, the lasers, and they really didn't include any type of wellness or any type of regenerative medicine. So, but it seems like more and more and more practices are trying to bring that in. So, what are your thoughts on what's fueling that?
Well, I think that people are really honing into fixing the body from the inside out. So we're more conscious about what we're eating. We're more conscious about our exercise regimens. As far as the wellness injections, that's honing into the repairing the cells from the inside out too. I think that's really big in aesthetics. People are really thinking about healing their cells from the inside out, and then the aesthetics on that to correct the outside of the body itself as well.
Okay. Now, when it comes to your practice specifically, Blush Medical Aesthetics, what's your long-term vision for your practice?
My long-term vision is to just be super, super busy, to be way busier than I am now. This is only my, I think, 12th week of being open.
Oh, wow.
So I am
Congratulations.
still just a little bit slow right now. But it's so funny. Some days, it's just really, really slow. But some days it's so many people here. And I'm like, okay, maybe I need to go ahead and hire somebody. But it just kind of comes in waves. But my overall goal is to just be very, very busy, to hire an LPN. I've talked to an LPN that's going to be coming here probably in a couple months, and to hire more injectors, nurse practitioners. Absolutely want to be able to hire more nurse practitioners and more nurses and medical assistants as well.
Okay. Well, it sounds like it's a wonderful, bright future ahead, the vision you have for your practice.
Yes, thank you.
Okay. So, Misty, I have one last question for you, but before I ask it, I do want to point people to your website at blushmedicalms.com. Now, last question is, what does beauty mean to you?
Beauty means to me feeling your best self. I can't feel somebody else's best self. Only they can feel their own very best self.
Well said. Well, there you have it, Misty sharing her expertise. So, Misty, where can people contact you in your practice?
So blushmedicalms.com can get you to my website. Also blushsouthaven.com can get you to my website. That's a little bit easier to remember. My phone number is 662-298-4714. And I am located at 940 Church Road West, Suite B in South Haven, Mississippi. So you can call, you can even book online if you'd like to. If you'd like to come in for a clinic tour, I'd be happy just to come in and talk to you about my services and give a clinic tour. I do that quite frequently. People just wander in and want to know what's going on here. So I just take them under my wing and explain everything that I do and show them the whole clinic. And they're real happy to know everything that is available here.
Awesome. Well, Misty, it's a pleasure. Thanks for coming on, and thanks for sharing your knowledge and expertise.
Thank you, Daniel. I appreciate it. I enjoyed it so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.